Hi people, today we are looking at methanol poisoning. Okay, methanol is nothing but methyl alcohol. It is a poison to our body. So let us look at how to treat methanol poisoning. Okay, methanol or methyl alcohol, it can also be called as wood spirit. Where do people get it? Why do they consume it? Okay, possibly that it is added to alcohol. Okay, adulterated alcohol, denatured alcohol like industrial spirits, industrial alcohol, they will add this methanol to make sure that people don't drink the alcohol. Okay, so denatured alcohol. Now coming to actually what happens to methanol in our body, it follows zero order kinetics. Okay, and it has a T half of almost 20 to 60 hours. Okay, now the thing with this is it's a poison. 15 ml of methanol can lead to blindness and 75 ml can be fatal. Just remember this blindness thing, okay, because it's a very unique thing. Retinal damage can occur with methanol. Okay. What else? I told you T half is over. Then it is a CNS depressant, a very mild, not as much as ethanol. It is a mild CNS depressant. It causes respiratory depression. Okay, these are things that you have to know. It causes respiratory depression. It is metabolized to formaldehyde. So alcohol becomes formaldehyde, aldehyde becomes acid, right? You know that sequence. So methanol becomes formaldehyde and then formic acid. This formic acid will lead to acidosis in the body. This formic acid causes injury to retina. So there will be dim vision and blindness also possible. Okay, is this much clear? Moving on, so just explaining here what happens. Alcohol becomes aldehyde. The enzyme is alcohol dehydrogenase. Aldehyde becomes acid. This is aldehyde dehydrogenase. Easy, right? Pay attention. If you're sleeping, please wake up. Wake up, wake up. So you got it right. Alcohol becomes aldehyde, alcohol dehydrogenase. Aldehyde becomes acid, aldehyde dehydrogenase. Acid further becomes water and carbon dioxide via folate dependent enzymes. All these you have to remember because the treatment will be based on this. Okay, because the toxic metabolites are formaldehyde and formic acid. So these will be the toxic metabolites which we have to remove. You got it right. Aldehyde and acid are the toxic metabolites. Are you awake? Let's move on to the symptoms of methanol poisoning. What happens if you take methanol poison? This person will start vomiting, he'll have headache, epigastric pain, uneasiness, drunkenness, disorientation, tachypnea, dyspnea, bradycardia, hypotension, delirium seizures may occur, the person may go into coma. Okay. Delirium, seizures, basically eye related symptoms also you should write here. Dim vision, okay, vision also will be affected, right? Vomiting, headache, you'll write for everything on earth. Disorientation, drunkenness, obviously drunkenness you can write, it's alcohol, right? Fine. Dim vision you already know, correct? Bradycardia, dyspnea, he can't breathe easily. Okay. Treatment. Now you should know how to treat the person. We are moving to the last part of methanol poisoning. Treatment. Dark room. Why? Because his eyes are getting affected. Maintain ABCs. Airway, breathing, circulation, because he has dyspnea, tachypnea. Right? So you have to maintain airway, breathing, circulation, endotracheal intubation they had told. Gastric lavage, if it is within 2 hours of consumption, you can do a gastric lavage. Hemodialysis to remove the existing toxic metabolites. Basically, if you want to remove the toxic metabolites, you will do hemodialysis, correct? Gastric lavage will remove the poison and hemodialysis will remove the toxic metabolites like formaldehyde, formic acid. It can also remove methanol. Gastric lavage also can remove everything, right? Within 2 hours if the person comes, you can do gastric lavage. Moving on, we have fomepizole. It is actually nothing but 4-methylpyrazole. It is actually the preferred agent. It is the preferred agent for treatment of methanol poisoning. It inhibits alcohol dehydrogenase. As it inhibits alcohol dehydrogenase, the toxic metabolites are not going to be formed. Did you understand? Are you awake? So I am hoping that you are awake, and I am telling you the treatment method. The most preferred agent for treatment of methanol poisoning is fomepizole. It is nothing but 4-methylpyrazole, and it inhibits alcohol dehydrogenase so that the toxic metabolites are not formed. Okay. What happens to the methanol which is remaining? Methanol will anyways get removed by unchanged. Methanol will get removed unchanged in urine. Okay. Next, going to the next treatment, we are moving to the second point here. Sodium bicarbonate. These are given to correct acidosis. I hope this is clear. You're giving sodium bicarbonate because this is bicarbonate, HCO3 minus, right? You will give it to correct acidosis, and you will prevent injury to retina, which is most important. Okay. So this is a very important step, most important step. So you can protect the eyes if you give what? Sodium bicarbonate, because sodium bicarbonate will protect the eyes. Whatever toxic metabolites are there already formed, it will protect the eyes from those toxic metabolites. Fomepizole will make sure that further these toxic metabolites are not formed. Then we are coming to the other part of the treatment here. Ethanol. Ethanol is nothing but ethyl alcohol. It is present in normal alcohol, liquor, right? And this has to be given 10% via nasogastric tube. The concentration should be 100 mg per deciliter in the blood. If at this concentration, if it is present, it will saturate all the alcohol dehydrogenase enzymes. So ethanol is preferred for this enzyme. Ethanol is preferred. This enzyme, let me tell you, this enzyme, if methanol, ethanol both are present, it will actually pick up ethanol. This is the whole trick here. That's why you're giving alcohol to treat alcohol poisoning. Did you understand that? Okay, you understood, right? Ethanol takes priority over methanol. Now, ethanol will saturate the enzyme alcohol dehydrogenase, okay, and it will not let methanol get metabolized. So, methanol cannot get metabolized because it is not getting the enzyme. Enzyme is not ready to pick up methanol. So, the toxic metabolites like formaldehyde and formic acid are not going to be formed further. Further formation will be stopped here. Fomepizole also is doing something like this only. What is fomepizole doing? Remember, it will inhibit the enzyme, okay. So, here also methanol cannot get metabolized, however, ethanol will get metabolized. Now, methanol will be excreted unchanged in urine and breath, as we have already told you. Coming to the last part in this treatment, calcium leucovorin. Calcium leucovorin has to be given IV. It is a folate. It's a folate adjuvant therapy. It is also called as what? Folate adjuvant therapy. It increases the metabolism of formate, that is formic acid, and it reduces the levels of toxic metabolites. So, formic acid will reduce, it will become carbon dioxide and water. So, I hope you understood that. So, I am showing you this slide where we earlier saw how the enzymes work, right? So, this folate adjuvant therapy, right? This folate dependent enzymes, that's what we were looking at. This step, acid to carbon dioxide and water, this step is promoted more by calcium leucovorin, correct? Calcium what? Leucovorin, folate adjuvant therapy. It increases metabolism of formate, it reduces the level of formic acid in the body. Reduces level of formic acid, okay, which is a toxic metabolite. Got it? So, now it is time for revision. So, we want to revise methanol poisoning, okay, treatment, only treatment part we want to revise. So, what and all you will do, you will put the person in a dark room, you will give ABC, airway, breathing, circulation, gastric lavage. If within 2 hours, okay, within 2 hours you can do gastric lavage, or you will give, what was it? Hemodialysis to remove toxic metabolites. Actually, gastric lavage, after that you can put the first line of treatment, that is sodium bicarbonate. Sodium bicarbonate to neutralize the acid so that the retina is saved. Then you can give first line of drug. What is the preferred agent? What is that? F something, right? Try to recollect. I would rather put hemodialysis after all that. Anyways, fomepizole, right? F-O-M-E, fomepizole, correct? Just see if you got the spelling right. Yes, fomepizole. It is also called as 4-methyl-pyrazole. This was the preferred agent. It is going to inhibit alcohol dehydrogenase. After that, you can try giving ethanol. Ethanol will make sure that ethanol will take preference over methanol in the enzyme alcohol dehydrogenase. So, ethanol will take preference. So, it will make sure that methanol cannot further be metabolized into the toxic substances. Then you have calcium leucovorin. Calcium leucovorin, what it will do? It is going to make sure that the last step, that is the formic acid, is going to be, it's going to convert formic acid into carbon dioxide and water. Fine. So, if it becomes carbon dioxide and water, it's better, right? So, formic acid is a toxic metabolite. So, formic acid you are removing from the body, the level. Okay. So, is methanol poisoning treatment very easy for you now? Will you be able to write in the exam? Very good. Bye. Guys, just one more thing we want to add. If you want to get more marks, now you should draw a diagram. If you draw a diagram, now you will get more marks. It is easier for the person who's correcting. So just draw this diagram from KDT, okay? Methyl alcohol. Alcohol will become aldehyde. Aldehyde will become acid. The enzyme is alcohol dehydrogenase. Aldehyde dehydrogenase. Formic acid will become water and carbon dioxide if you give it folate dependent enzyme. Fine? Easy, no? And fomepizole will inhibit alcohol dehydrogenase. Fine. And alcohol dehydrogenase, ethyl alcohol will be the preferred substrate, not methyl alcohol. Fine.